Men are not accustomed to talking about hormones the way women are, but doctors say it's important for them to know if they have low testosterone, since it can lead to conditions ranging from heightened cancer risk to loss of muscle. Here with more on male menopause, and I know that's not what you call it, is Dr. Desmond E. Banks, Medical Director of Alternity Healthcare in West Hartford. Thanks for being here.
Oh, it's my pleasure.
I know you guys don't call it male menopause, but there is such a thing.
There is actually such a thing, and a term has been coined, andropause, to mimic the female menopause, or the more accurate medical term is hypogonadism.
Okay, and what happens?
Well, starting in the mid-30s to 40s, men start losing their testosterone typically at a rate of 2 to 3% per year. And by the time they reach their mid-40s to early 50s, they can start to feel some of the effects.
And what are the effects? What would be the signs?
One of the earliest signs for men is loss of a morning erection. When they're in their 20s and teens, every morning they're just about to wake up with an erection. That's one of the earliest signs, loss of the erection. Reduced energy, loss of libido, cloudy thinking, difficulty concentrating, difficulty sleeping, and loss of ability to perform physically. Sports performance is one, and energy level.
Now, for some people, I imagine they can kind of have a premature drop in testosterone level in life, so it can happen early on. Would that be the issue?
Well, there are conditions, hypogonadism, that can happen to much younger men, and that's separate than I think what we're talking about here, what happens typically with aging.
Okay.
But there's some men who do not produce enough testosterone, but those are medical conditions that have to be screened out for anyone.
Okay, so that you might have a more aggressive approach to. But for the regular man who's just gradually having lower testosterone,
yes.
Isn't that just part of life?
Well, not any more so than for women. Just reaching menopause has to be part of life. It occurs. There's now thinking that not so much that your testosterone level drops because you get old, but you start to feel old because your testosterone level drops. Obviously, maintaining good testosterone, you'll look better. You'll be able to maintain body composition better. You'll feel better. You'll feel more energetic. You'll feel more sexual. You'll have harder erections. You'll have better sex, and all of that is wonderful. But in the last several years, the real important thing is that the medical literature has shown that as testosterone goes down, your risk of cardiovascular disease, type 2 diabetes, prostate cancer, maybe even Alzheimer's disease goes up.
So your recommendation is for men to get their testosterone level checked?
Yes.
How is that done?
It's a simple blood test.
Okay. Mm-hmm. And from there, what will you do for a man who has low testosterone?
Well, now it would depend on the reason. There can be a number of reasons why it is low. So when I say simple blood test, it's actually several blood tests. We have to test the testosterone. We have to test what we call the free testosterone, which is what is really available for your body to use. There's a protein that can bind testosterone, so we measure that. That can cause it to drop. We also measure estrogen, the female hormone that men have a small amount of, but there's an enzyme that can convert your testosterone to estrogen, and that's typical as men's bellies get bigger. The estrogen level tends to go up, and there's some people who are famous for having man boobs, and that's a sign that the estrogen level is too high.
And is there something you can do to bring the estrogen level down?
Yes, there are some supplements that can be taken to help block that enzyme, and there are medications that can effectively block that enzyme to reduce that conversion and keep more of your testosterone as testosterone.
So are you a proponent of testosterone injections?
I am. Testosterone can be replaced in a number of ways. You can use pellets, which require a small surgical procedure in the office, and you have pellets inserted under the skin. I don't like that approach because once the pellets are in, they cannot really be removed. So if you have any issue or too high of a dose, it's very difficult to manage. There are a number of creams. Many people may have seen the low T commercials on television, and that's for pharmaceutical creams that are relatively low potency. So they're good for men who may be on the borderline, but there's only so much that those creams, those topicals, are going to raise the testosterone level. So I'm a big proponent of weekly testosterone injections. It gets the dose right up. It's easy to manage and titrate the dose, and you feel better a lot quicker.
But I understand that increases a man's risk of prostate cancer.
That is a long-held belief, and that actually is a myth. And as you look back through the medical literature, it really is based on a single case report many, many years ago. There was a a review of the literature published in the New England Journal of Medicine in 2004 that found absolutely no correlation between testosterone level and risk of prostate cancer. And there was a separate review published out of Harvard, small place in Boston, you may have heard of Harvard, and they also found no correlation between testosterone level as it goes up.
That's funny because anecdotally I've spoken to doctors who say
Correct.
they're seeing some early cases of prostate cancer in men who were shooting testosterone early in life, kind of trying to get that super edge.
Well, separate thing. That's super physiologic dosing. We're talking about maintaining in the physiologic range. So we're taking men from the low end of the range into the upper third of the normal range. So
Okay.
again, totally
So
different
you're
thing.
talking about testosterone injections that would bring a man's testosterone level to the normal level. And the risk, would you agree there is a risk if you're bringing testosterone up above that?
Absolutely.
Okay.
Absolutely.
And the risk would be prostate cancer?
The risk potentially could be prostate cancer or other tumors, liver diseases. Yeah. So
Not a good idea.
just like any other medication, if you're prescribed one pill and it's effective, that doesn't mean 2, 3, or 4 is going to be better.
I understand. Well said. One last question because we're wrapping up for a commercial. If somebody's 35 years old, their testosterone is fine and they want testosterone injections, will you go for that?
No.
Okay.
No.
Just curious. Thanks, Doc.
You're welcome.
Up next, checking your DNA to make sure serious lab results with your name on them are definitely yours.